Good day, ma'am. I am Crystal Jade as Busmion, your nurse student from J.H. Cirelia State College, Pagadian, and I will be assessing the client's nose and sinuses for today. Good morning, sir. I am Jade, your nurse for today, and I will be assessing your nose and sinuses. But before we go into our assessment, sir, can I have first your basic personal data?
Sure.
Okay, so what is your name, sir?
Jeremy Sarabia,
How old are you?
21.
Date of birth?
April 9,000.
Municipality, sir?
Pagadian.
Okay, sir, for your mobile number, kindly fill up here for your record.
Sure.
Okay, thank you, sir. So, how are you today, sir? I mean, how's your feeling for today?
Good.
Okay, that's good. Okay, sir, in this assessment, I have to inform you that I have to palpate and inspect your nose so that we can be able to know if there is developing illnesses within your nose or in your body. And we can get treated it immediately, sir. And I can assure you, sir, that my hands are already clean. I have already washed my hands and sanitized using Green Cross. And whatever the result will be, sir, rest assured that as your nurse, I will help you in order to have a appropriate nursing intervention or treatment. Okay. So in order to proceed in our assessment, sir, I have further questions here and you need to answer it honestly, okay? Do you have any history of the following, sir, like allergies?
None.
How about difficulty breathing through the nose?
None.
Sinus infection, sir.
None.
How about injuries to nose or face?
None.
Nosebleeds.
None.
Medications taken or changes in sense of smell?
None.
Okay, thank you, sir. Okay, again, sir, kindly sit erect, sir. Just feel relaxed. First, we will inspect and palpate the external nose. Okay, thank you, sir. Upon inspecting and palpating the client's nose, color is the same as the rest of the face. The nasal structure is smooth and symmetric. The client reports no tenderness. Next, we have to determine patency of both nasal cavities. Okay, sir, this time, kindly participate with me. Close your mouth. Kindly breathe for me, sir. Okay, the other one. Kindly breathe for me, sir. Okay, thank you, sir. Upon checking patency of airflow through the nostrils, client is able to sniff through each nostril while other is occluded. Next, we will inspect the nasal cavities. Okay, sir, this time, I want you to participate with me. Kindly tilt your head back. Okay, thank you, sir. Upon inspecting the internal nose, the nasal mucosa is dark, pink, moist, and free of exudate. The nasal septum is intact and free of ulcers or perforations. Turbinates are dark pink, moist, and free of lesions. Next, we have to palpate sinuses, which is the frontal and maxillary sinuses. Okay, sir, this time I have to palpate your maxillary and frontal sinuses. Do you consent? Is there tenderness, sir?
None.
Okay. Let's go to the maxillary. Is there tenderness?
None.
Okay, thank you, sir. Upon palpating the maxillary and frontal sinuses, frontal and maxillary sinuses are non-tender to palpation and no crepitus is evident. Next, we will percuss the sinuses, which is the maxillary and frontal. Okay, sir, this time I have to percuss your frontal and maxillary sinuses. Do you consent again, sir? Is there tenderness, sir?
None.
Is there tenderness, sir?
None.
Okay, thank you, sir. Upon percussion, the sinuses, which is the maxillary and the frontal, the sinuses are not tender on percussion. And lastly, document findings in the client record using printed or electronic forms of checklist supplemented by narrative notes when appropriate. Okay, sir. Thank you for your availability and participation in this assessment. And so far, sir, the result is all normal. And I can assure you, sir, that the result will be confidential and discussed by other healthcare team. That would be all. Thank you.